So my name is Jo Morrison. I am a consultant gynecological oncologist, and I'm also a colposcopist, and I work in Musgrave Park Hospital in Taunton. We have a test that allows us to be able to check for changes in cells in the cervix, which happen many years before they can develop into cancer. So unlike most cancer screening programs, we're not actually screening for cancer, we're screening for changes that can develop into cancer if left untreated over some years. So it allows us to find people before that ever happens, and then treat them and prevent them getting cancer. It used to be that we just checked when we do a smear test to see how abnormal the cells looked, but we've found that most cervical cancer is caused by a virus called HPV, and we're now able to offer a test for that and then only look at the cells if the test is positive for HPV. So anyone who has a cervix is invited between the ages of 24 and a half and 64. So as long as you've had a normal smear over the age of 60, then you can be ceased for the screening programme. So when you're invited for a cervical screening test, and that's normally done at the GP practice, normally with one of the practice nurses who's been specially trained in how to take cervical smears. So what it involves is using a small either plastic or metal device that is inserted into the vagina and very gently opened so that they're able to see the cervix at the top of the vagina, and then use a little soft brush to just brush around the cervix, which takes some cells from it, and they're put in a little pot with some fluid for them to send off to the lab. It normally takes about, most of the time is the time spent explaining what the smear involves, and then maybe getting dressed and undressed, and actually taking the smear itself, as long as they can find your cervix relatively easy, just takes about 30 seconds or so. It varies depending on which lab they're sent to, but normally, and it also varies depending on whether they need to have a look at the cells or not. So with the HPV test itself, that can come back within a week or so. It might take 2 to 3 weeks if they have to look at the cells. So if you have HPV on your test and your cells look normal, and that's the first time that that's happened, then what's advised is that you have another test a bit sooner. So instead of it being in either 3 or 5 years, depending on how old you are, it would be in another year. But if your test shows that not only is there HPV, but also the cells look slightly abnormal, then what happens is that you would then be referred to colposcopy. What happens is that you'll get that result directly from the laboratory, and then the colposcopy department will be in touch with you to send you an appointment, which will either be within 2 or 6 weeks, depending on how soon we need to see you. So colposcopy just really means looking in the vagina. So what it involves is, the first part is very similar to having your smear taken, is that we use a small speculum, which is either a plastic or a little metal device to hold open the walls of the vagina so we can see your cervix properly. And then we use a microscope so we can look in really fine detail at your cervix, and we paint either 1 or 2 special dyes on. One's a weak vinegar solution and one is a type of iodine solution, and that can show up the changes that are otherwise not visible when you look at the cervix, and that will let us know what sort of level of changes there are. Sometimes we need to take a little biopsy, sometimes we would recommend treatment at the time, and most treatments can normally be done at the same time with a local anaesthetic. So the HPV vaccine is fabulous, and we know that over time it's going to really dramatically reduce the amount of cervical cancer, and it's already having a really big effect. Those who were vaccinated when they were young, about 12 or 13, have got a really low chance of developing cervical cancer. But the vaccine only vaccinates for the more common types of HPV that can cause cancer. So it's still really important that people get their screening done. So it's a misconception that you only have cervical screening if you're sexually active. So you can get HPV through any sort of close sexual contact. So that can be with women who have sex with women, or it can be with non-penetrative intercourse. So it's really important that you have screening if you've had any sort of sexual contact. So screening is still really important for the reasons that I've just explained. The slight complication is that if you go undergo gender reassignment, you are given a new NHS number as a male rather than a female, which means that you then won't be offered cervical screening through the cervical screening programme. But it's really important that you get that done still through your GP practice. So the reason was, it used to be earlier, it used to be 20, but what we found is that cancer takes a while to develop from when you get the first changes, and that screening in those who are under 25, you end up finding lots of people who have these changes, because these changes are really common. We're all exposed to HPV, and many of us will develop those changes, but most of the changes in young women will go away on their own within a few months or years. So therefore, if you screen people younger than 25, you pick up a lot of things and end up over-treating people that may well have gone back to normal on its own. And we know that screening in the under 25s isn't really very good at picking up the rare cancers that can happen in those who are under 25. So that's why they made the changes a few years ago. Definitely not. HPV is something that's really prevalent. Everyone's really been exposed to it at some point in their life. It's something that can take some time for it to become apparent and for us to be able to pick it up on the smear test. So it doesn't mean that anyone has been naughty recently. So that's a really good question. So the first thing is that you can take someone with you if you want someone to hold your hand. I mean, none of us like having it done. It's something that we all, do, a bit like going to the dentist. It's not something that you volunteer for willingly, is it? But I think just let people know that you're a bit scared and a bit nervous. Wear something, so wear a long top or a dress maybe, so you feel a bit more covered up, not quite so exposed when you take your bottom half off. You just pull the dress up. They'll normally give you a little sheet or something just to cover you up and make you feel a bit less exposed. You can have someone to hold your hand if you want. Just let them know that it's something that you find tricky. Sometimes they'll get you to change your position a bit. Depends on whether you've got a womb that tilts forward or backwards. Sometimes they'll ask you to make fists out of your hands and put them onto your bottom just to tilt your pelvis a little bit. Also, having a nice couch like we have here sometimes can make it a lot easier, and it's something that if you do have trouble, then sometimes GP will send you up to us, because we do lots more cervical screening and we have a nice couch that can make life a bit easier. The other thing is, if you're older, so if you've gone through the menopause and you're not on HRT, you might want to think about using some vaginal estrogen for a couple of weeks beforehand. It helps to plump up the tissues and make the skin of the vagina a little more supple and makes it a bit less uncomfortable.